It's time now for Rejuvenate Health, and I have in the studio Dr. Moshe Dekel with Rejuvenate Health on Hilton Head Island. And we had mentioned in previous broadcasts about vaginal dryness and vaginal problems as we age, and also in men, erectile dysfunction. And we've talked about various ways of addressing the issue, but one I would like to address that was for both men and women, and that is a shot that seems to have long-term effects, not a weekly shot. Tell me what I'm talking about, doctor.
What we're talking about is PRP. PRP stands for platelets-rich plasma, which in simple English is taking your own blood, patient's blood, spinning it down and getting the component of the platelets in concentration and introducing it back either into the penis or vaginally. What that does, the PRP contains growth factors. It's not stem cells, it's different. But the growth factors have tremendous ability to rejuvenate, to regenerate, and actually call your native stem cells to come and do the job and rejuvenate the area.
Now, this sounds like just what you said. It rejuvenates, and that's an ongoing process. How many of these sessions or shots do you have to have before you're there?
Again, it's a good question. Usually in our experience, we find that most men use one shot and they get good results, 80% improvement after one shot. Once in a while, they need to do a boost. For women, it's very similar. So it's really working very well. It's been around now for over 10 years. And there are about 1,200 doctors in the world are doing it right now. It was, as I said, started about 10 years ago.
Why wouldn't anyone over the age of 50, 60, even 70 do this if it will rejuvenate, a vital part of our life?
Well, it's a good question. First and foremost, people need to know it exists, okay? And they should get the information because, yes, a lot of people can use it with help. Obviously, that's not the only way to go about it. We need to make sure that the hormones are correct, and we spoke about it a lot, podcast, et cetera. But assuming the hormones are fine and they're being addressed and we still have an issue, yeah, definitely a consultation regarding this and researching is definitely a good idea for men and women alike. And by the way, I know especially men are kind of say, he's going to do what? He's going to inject.
You're going to stick that needle where?
Where?
I'll say it for you.
Yes, and I can tell you one thing. Obviously, we use a numbing cream, and I can tell you that initially, before I got trained a few years ago, etc., I told myself, really, do I want to do that? But in hindsight, as I'm doing it, it's almost a non-event for men and for women too, because we use a numbing cream, we use a little local infiltration, and the pain is really the fear of what's going to happen to me and how much it's going to hurt. But in reality, it really is not an event.
The only thing you have to fear is fear itself.
Yes, fear itself.
Yeah, okay. Well, I think this is an amazing opportunity for everyone. Like you say, if the hormones are right and you're still not happy, first go to Rejuvenate Health, let them check your hormones, and then know that you can be rejuvenated back to a youthful time in your life. Rejuvenate Health, right here on Rewind 1079. Our goal is to rejuvenate your health.